How does CPSS compare to other PTSD scales? When we talk about the Child PTSD Symptom Scale, or CPSS, we are looking at a vital tool for assessing post-traumatic stress disorder in children aged to 18. This scale is crafted to align with the diagnostic criteria in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. The CPSS can be used in two ways, as a self-report or through an interview format. This flexibility makes it accessible for different situations. So, how does the CPSS stack up against other PTSD scales? First, let's look at its structure. The CPSS consists of 20 items that assess PTSD symptoms and 7 items that evaluate how these symptoms affect daily life. In comparison, the clinician-administered PTSD scale for DSM-5, often called CAPS-5, is more comprehensive but mainly designed for adults. Next, let's discuss psychometric properties. The CPSS shows excellent internal consistency and test-retest reliability. This means it is a dependable tool for measuring PTSD in children. It also has good convergent and discriminant validity, which means it effectively measures PTSD symptoms while distinguishing them from other mental health issues like anxiety and depression. One of the key differences is the age focus. The CPSS is specifically designed for children, making it especially useful in pediatric and adolescent mental health settings. In contrast, tools like CAPS-5 are primarily for adults. Now let's compare the CPSS to other scales. The CAPS is often seen as a gold standard for adult PTSD assessment, while the CPSS serves a similar role for children. Both scales are structured interviews based on DSM criteria. Another tool, the PTSD checklist, or PCL, is a self-report scale used for civilians and military personnel. However, it is less structured than the CPSS and does not assess functioning. Then there's the Impact of Event Scale, or IES, which focuses on the psychological impact of specific traumatic events. However, it does not provide a comprehensive assessment of PTSD symptoms like the CPSS does. In practical terms, the CPSS is invaluable in clinical settings for diagnosing PTSD and tracking symptom severity over time. It also plays a crucial role in research, helping standardize how PTSD is assessed in children. This standardization allows for more consistent data collection and analysis. In summary, the CPSS is a specialized tool for assessing PTSD in children. It offers a structured approach to diagnosis and symptom severity assessment. By focusing on the pediatric population, it complements other PTSD scales and provides a thorough evaluation of both symptoms and their impact on daily life.